Hi, I'm Lynne Hinterbuchner, registered nurse in Austria in Salzburg University Clinic, and I'm here today with Gerda Donnelly, and we're going to be talking about mitral insufficiency treatments with new technology. First, I'd like to ask you, Gerda, what do you think is really important to explain the difference for nurses to really understand why the new technologies are here? What difference does it make for FMR or DMR, your functional or your degenerative regurgitation? Can you explain that a bit?
Yes, I try to. Hi, Lynn. DMR and FMR for our mitral valve is a very complex and not so easy valve. So patients go in and they are diagnosed, and then it has to be differentiated. FMR is the structure around our valve, and if that is sick, it is totally different than to DMR. DMR is our valve itself. It's the leaflets and the chordae tendineae. And that has, of course, makes difference of treatment because there are so many devices on the market now. It's a crowded place, and you have to differentiate which device is the best for the patient.
Okay, and if I'm correct in saying that all these patients are high risk, so they're sick patients.
They
so
are
not
very
everybody's
sick.
going to be involved.
They're very
in
sick patients. Our elderly patient, and we're all getting very old now. So they cannot go in for surgery. It's impossible. They wouldn't survive it. So either they stay on medication or they try one of these new devices and they are advised to it.
Okay, so we know these patients are sick. They're going to be coming to us in the cath lab. How can we best prepare our nurses and allied professions when this new technology is coming to the lab?
Yes, the best thing, of course, normally, you have been told, okay, this new device is coming and we are doing it tomorrow. But to be honest, could be well prepared if you have the industry, your doctors, all the nurses, as a team, cardiologists and surgeons in one group, and the whole system is explained, shown on models, and you go through step by step what you need, which material, what the patient is like, the whole outfit.
Okay, so what you're saying is it's probably a good idea to have standard operating procedures, a pathway developed and in place, educate the nurses, physicians, everybody on the team before it's in place in the hospital, because then you have a better patient outcome. You're working as a team.
That's right. It's much faster, and maybe you can visit another cath lab where it's been done already, and they can give you some very good advice how to prepare the patient and work sterile.
Okay, very good. One of the things that I think is interesting is these patients are very sick. You're giving them a hope for a better life and a better outcome. What do you suggest for rehabilitation? Are these patients, should they be seen afterwards? What's the interval or any suggestions on that?
Well, these patients are very sick. And of course, they like to go home because they are not the youngest patients, so around 80. But they should go into a rehabilitation so they learn about their illness. They learn how to go about with it because they are not healthy again. They're not going to run a marathon afterwards. You will not change an 80-year-old person anymore very much. But to give them some advice, not to leave them alone because they are afraid. So that is very good. At the moment in our hospital they are seen after 4 weeks and then after half a year. But it would be very good if they go in for teaching how they move around, what they're going to eat, what they can change, that they are allowed to move around. Even if they want to ride a bike, they can go and ride a bike. But they are afraid what they can do, so they should be taught.
So I think if we want to summarize for these new technologies that are coming, it's very important because there's so much, a lot of things are on CE marked trials, a lot of the products and technology are still in trial form, and there's a small amount of patients that have actually had the new device implanted. So I guess we could sum up that one of the key things is to educate the nurses and allied professions on the team before it's brought into the hospital. So you have this new technology, what do we need to know, what equipment we have, who's doing what in the cath lab, et cetera. So teaching the team together is what's important.
Is one of the main parts, most definitely. And the whole procedure is then calm, it has a flow, and a very good result. And
Better
everybody
outcomes.
is motivated and happy.
Very good.
Yes, okay.
Thank you, Gerda. This is PCR Online TV.